Well, clearly, our thoughts and prayers go out to our colleagues and friends in Japan who are in the midst of a terrible disaster. One of the areas that can be affected in the body is the thyroid gland. And the thyroid gland takes up iodine to make thyroid hormone. And there's iodine that we get in our diet from things such as iodinated salt. And there's radioactive iodine that, of course, comes from the release of radioactivity into the atmosphere. The body cannot differentiate between the normal dietary iodine and that's released into the atmosphere. So what happens is when the thyroid gland takes up the radioactive iodine, it leads to cellular damage that can lead to thyroid cancer later in life. And typically these cancers occur 5, 10, even 20 years after the exposure to the radioactivity. One of the things that can be done to prevent thyroid cancer is to take iodine tablets before, preferably before an event, but certainly within 24 hours of exposure to the radioactivity. If you wait more than 24 hours, there's really no benefit in taking the iodine. People that are in an area of exposure, of course, would benefit, and it's primarily children and pregnant women. And what we know is that the thyroid gland in children is one of the most metabolically active glands. There's a lot of cellular turnover, and as this radioactivity is taken up, it can lead to this genetic change that I mentioned before. So it's not recommended that adults over the age of 40 take iodine supplementation, but certainly children and pregnant women should if they are exposed to these high levels, such as in Japan. In the United States, there's no need to panic. Those folks on the West Coast do not need to go out and buy or take iodine supplementation. If there is radioactivity that reaches the West Coast, it will be a low dose and not of the level that will cause or contribute to the incidence of thyroid cancer.